Good afternoon, ladies and gentlemen, and welcome to the DEEPVERGE PLC Project Update Investor Presentation. Throughout this presentation, investors will be in listen-only mode. Questions are encouraged and can be submitted any time via the Q&A tab situated in the right-hand corner of your screen. Simply type in your question and press send. The company may not be in a position to answer every question it receives during the meeting itself. However, the company will review all questions submitted today and will publish responses where it's appropriate to do so. These will be available via your Investor Meet Company dashboard, and you'll be notified once they're ready for your review. I'd also like to submit the following poll and also remind you that this presentation is being recorded. I'd now like to hand you over to Jerry Brandon, CEO of DEEPVERGE PLC. Good afternoon.
Good afternoon, Paul. I should submit that as well, should I? Am I a shareholder?
I think you are. Thank you.
Yes, indeed I am. Indeed I am. Okay, good afternoon, everybody, and thank you very much for joining me this afternoon. Some of you may have seen the proactive interview this morning. Some of that I will cover, and there will be ability for me, at least in this, to explain a little bit further some of the issues that I couldn't put into an RNS. Not that I will actually disclose anything more than I should under AIM Rule 10, 11 and EU MAR 17, but nevertheless I hope to actually give you enough information on this to allow you to understand what the investment case is for joining us here at DEEPVERGE. So without further ado, again, just looking back to go forward, when the management of DEEPVERGE at the time of integument back in 2018, we took over. The company had 5 employees. It was in a bit of a financial state, but it had some wonderful technology. And during those 2 years, a number of acquisitions have taken place. I'll touch on those a little bit later. And long-term holders, and basically I'm a long-term holder, as management are, and yourselves here are. We've done reasonably well. If you actually look at the actual share price, where it is now, 1 year ago, it's up 229%. And over the last 3 years, just before I got myself and the team got involved, we're up over 3 times what it was when we actually got involved. So I understand also some of the frustrations that may well be in place from retail investors who got in a little bit later, but this is a long-term project. We're building a very large organization in multiple divisions to solve multiple societal problems. And I'll go through some of those and justify the reason why this is a long-term project for us. So the 3 areas within the organization are skincare, which covers Labskin, which is the core business of our company and where we originally started off from back in 2018. This is a company that has over 14 years developed, recognized the world over as being the #1 human simulated skin, equivalent skin. Human skin equivalent, HSE. And again, recognize the world over as one of the actual best skins for testing viruses, bacteria, toxins, and parasites, so pathogens. I'm using the word pathogens throughout the actual presentation here. So that we could actually give a real world environment on the skin, which led us eventually to be able to clone the skin microbiome, or clone the actual skin from clinical trial patients. And Skin Trust Club. Skin Trust Club is a very, very exciting side of our business, an extension to Labskin. It was built over the last 8.5 months, and it essentially takes the remote clinical trial of Labskin projects that we've been involved in with our major clients over the last couple of years, and turns it into individual, or it democratizes your ability to manage your own skin. And for the first time, I think, with the Rosetta Stone of skin, basically we're given a voice to your own skin to tell you exactly what it needs to actually make it better, to make it look as good as this. And I joke. Actually, I don't. So the second part of this actually relates to what has been around us for the last 12 months, which is the actual SARS-CoV-2 virus that we've all had to contend with in this global pandemic. And since September of last year, we've been involved in a number of tests with Aberdeen University, with the University of Liverpool and Genoa, and ultimately it's led to our own two containment level three laboratories in York that we've actually just announced earlier this month. So, and finally is the drinking water and wastewater. And I've seen a few comments on the bulletin boards relating to, well, why is he not talking about wastewater? Well, I'm talking about wastewater in this presentation today, so hopefully we'll cover some of those outstanding issues. A lot of the things that I cannot say are purely simply because of the non-disclosure agreements that we have in place with a number of regulatory authorities in a number of countries, in a number of continents. But nevertheless, we are working directly with regulatory authorities in a number of countries to roll out the wastewater, and I'll give you some explanation on that a little bit later. And that basically brings us to the modern water and the reason why we actually got involved with modern water, and I'll explain that as we go through the system as well. Our offices are now on 3 continents. They're in Delaware in the US, they're in York laboratories in Yorkshire. We have office in London, we have office in Cork, where we actually have the software and sales administration and the artificial intelligence core development team. And we have our facility in Shanghai in China, and we have office representation in Osaka in Japan. So we're pretty much 18 or 19 hours awake on the job every single day. And it sometimes feels like we actually have to go through that full 18 hours to keep this thing going at the pace that it's actually going. Products are sold in over 60 countries, and that's a result of 30 years that actually Modern Water has been actually distributing their products across multiple territories. And again, I'll cover some of that. So we're management. Obviously, we're represented and aligned, I believe, very much with the shareholder base. Myself, Finan, Camillus, Ross, and Nigel are the 5 grey men in suits, which is not necessarily a diversified board, but nevertheless, it has evolved to being a great team to actually work with and maintain the growth of this company with the knowledge and accumulation of institutional knowledge that all of these people have working around it. And it is very much a team effort. So our business transformation model, it's not a business model as such, because again, what we've done is we've actually transformed a number of different technologies, integrated them, combined them, and changed from selling equipment and selling individual elements or kits to a service-based recurring revenue model. And that has allowed us to actually go from 2018, where I think the turnover was less than £280,000, 2019, 823,000. That again multiplied 300%, 4.4 million last year, with an aggregated, so that was the accumulation of both DEEPVERGE's turnover for the year and the revenue that actually came before we acquired Modern Water, bringing it at 6.1 million. And that allowed us to, as early as January, to actually give guidance for 10 million of this year. Now, again, we can discuss on the target of what we would expect. We wouldn't have said 10 million if we knew we couldn't get 10 million. So basically, 10 million is your base. I'm not saying how much there is any more than that. That's our guidance. And until our guidance changes, that's pretty much all that I can actually say. Nevertheless, as you'll see throughout this presentation, what is actually happening in the last quarter even is quite substantial, and our growth in multiple areas may allow us to revise that later in the year. But for now, 10 million is our guidance, which should keep our Nomad happy, which should maintain corporate governance, and basically we do exactly what we say on the tin. We will actually hit 10 million this year. Nevertheless, Q1, we have orders of 3.6 million. And to put that in perspective, Modern Water last year did less than 2 million, did less than 2.1 million in total. So just for the first quarter, Modern Water's order level is 3.6 million. Labskin, I'll touch on that and where it's going. But again, the background on this was we acquired Rhino Cloud back in May of 2019. That was an artificial intelligence company that added substantial value, input and output of data that was never used and exploited for the 15 years that Labskin had actually been operational and building all of this data. It was never fully exploited. Now it is, and it has phenomenally transformed the company. So much so that from £15,000, we're getting services for £150,000. So it is transformational from our perspective. And this is framework agreement, so it's recurring revenue, and we build on top of that, which is why we can grow the revenues. The acquisition in November, on the 17th of November of 2020, brought in Modern Water. And Modern Water has a footprint that is of substantial value for us. It's already in 60 countries. It has regulatory approval and legislative toxicity testing in environmental protection for its microtox testing. So basically, it is the incumbent in any country where we're actually operational and trying to introduce new technologies such as the artificial intelligent instant identification of toxins in the water. They're already detecting toxins in the water. And if you want to test it, normally what you do is you take a sample, you bring it back to the laboratory, and you do your normal 24 to 72 hours. And yes, you have cryptosporidium or you have E. coli, boil water notices. In the meantime, they're queuing down at ER, vomiting and diarrhea. Basically, if you know within seconds, this is the actual way that we actually are adding value to the clients, to the existing distribution channel, by identifying immediately what the contaminant is, and therefore we're monitoring, generating revenue upon top of the consumables that Modern Water are actually getting. We completed a placing in 2019, which was just the outstanding number of shares that we actually had without going to a general meeting at 1.5p. Because we're increasing on the revenue, access to debt is now freely available to us on a constant basis. If we, the number of offers of debt financing we have is weekly, sometimes twice, 3 times weekly. And we've only drawn down 1.5 million of that 3 million facility. We had cash of 3 million available to us at the end of the year. And since the end of the year, we've actually taken in £650,000 of warrants exercised that were due to expire in May of next month, the 2nd of May, 6 weeks from here. So it has allowed us to actually grow. And as you can see from just the graph on the left-hand side of your screen, this is the pace of growth. It's triple-digit percentage growth across all of our divisions. So we're seeing this growth continue well into 2021. Labskin itself, as I've briefly described, it's 14 years under development. It is a skin microbiome clinical trial. It allows us to actually work on human skin contaminated with virus and bacteria and whatever in the real world inside of our laboratory, test products and ingredients for clients, and they can then take it further and put that into a product, make the claims, and put it on the shelves of their high street drugstore. So 30 scientific articles have been published on this. Our laboratories in 2018 were only 924 square feet. Today, they're 9,000 square feet, so almost 10 times the actual original in a little over 2 years. And these are some of our clients that we are able to disclose because they're already disclosed out there. But we have 18 of the top 20 skincare companies in the world. All have used, use, and are fully aware and knowledgeable of our technologies that we use in Labskin. And these are the people that actually generate and give us the references for the lower end companies. Would you rather actually do it yourself, or would you actually like to have it in the same way that Estee Lauder has, Unilever has, Amway has, and Boots Walgren. So it makes it easier for us to actually bring in further clients. Obviously, those reference points are actually fabulous for us. We have the largest skin microbiome database in the world, bar none. And that basically means that we can virtually help companies, as we've done through COVID last year, help them distinguish between good and bad ingredients. Now, I mean good and bad ingredients as in better or good ingredients. So it reduces the amount of time and investment that they have towards getting their product to market. That eliminating, for instance, 8 out of 10 ingredients virtually means that it actually is reduced to hours as opposed to months in testing up to 10 items. This is quite exciting for us, and it's not like we have kept it under the counter. Basically, Skin Trust Club is the remote clinical trials for individuals. So rather than us actually doing a test for an ingredient for a major client of 20, 30 clients, what we're able to do is we're able to give everybody access to the same clinical data capability that we give to these large corporations. So you're getting Boots, Walgren, Johnson & Johnson, Unilever, Estee Lauder, L'Occitane, L'Oreal data that tells you exactly what your skin needs to be the best that it can possibly be. Now, we pre-launch this, we get pre-registration at the beginning of this month. And we said we're just going to do a number of alpha and then go into beta testing. And we had to close it at 5,000, and we're actually running an alpha test at the moment. I would have loved to have the app live for you to download at this point in time. It will be capable of being loading soon. We're still in beta, we're still tweaking, we're still giving the actual minor tweaks, but there is a substantial back end to this, allowing you to take the ingredients that you have, scan those ingredients, and then with the DNA swab of your skin, we know the state of your skin is based on the ingredients that you're using, and potentially recommend to you alternatives, or keep using this, or use more of that, or use less of that. So effectively, your own skin is telling you exactly what it is that you want to actually get the best out of that. And that takes into account your local environment, the seasons, from a hormonal level. We're all suffering from hormonal levels higher or lower when it comes to the COVID anxiety, etc. So stress and other things like that. But effectively, this is the first of a kind. And it's recognized not just by those who have actually signed up, but by the large corporations themselves. And we've actually been approached, fully open by some of these large corporations wanting to get in as part of the actual offering. And we've purposely held back a little bit to ensure that we only make recommendations on products that we know the ingredients that actually work on your skin. More will be revealed on that, and I look forward to actually rolling it out with everybody very shortly. Now, I say very shortly, it's available for download on beta testing, so it's a matter of weeks, not months, so just weeks. This is pretty much what it is, and the photograph on the right-hand side was actually tweeted by one alpha test subject who photographed their entire, I've just received this, I've just done this, I'm now posting it. But essentially, this is it. It is a home test kit that you will be able to either order from us or in cooperation with some of the actual drugstore companies that we're currently working with. And you'll be able to just buy it in the high streets. Effectively, it then gives you back your own consumer report. And this report is in the form of your app on your iPhone. And it will tell you what today's regimen should be, morning, evening, etc. So it's that simple. You take a swab of your skin, you follow the process. It's very, very straightforward. You post it back to us. It's not in any major fancy box because we are obsessed with sustainability. with recyclable capability, and not wishing to have massive amounts of single-use plastic and posh packaging. Effectively, it should fit through your letterbox. It should fit in the letterbox. It should not be a parcel, because again, notwithstanding the EU and Brexit issue, post gets through, parcels, God knows where that could possibly end up. So we actually designed this so that all across Europe, it could actually be posted directly back to our laboratories in the UK. So this is actually next generation personalized beauty. You've seen it. Some of these things are actually capable of downloading to your phone. You take a photograph or 3 photographs, and AI says you need this and this, and the pores are that. Effectively, the difference is Skin Trust Club tells you exactly what's on your skin. Absolutely down to the actual microbe level of what's on your skin. It doesn't need a photograph. It basically, the skin just says, this is what I am, this is what I need, and then here's a list of products where you can get them. And in principle, if you, for instance, were to actually take this product, this home test kit from one of the stores in Germany or Ireland or wherever, it will recommend products that are actually close to you in your store. It's not something that, oh yeah, well, it only goes back to this range of products. If the ingredients that you actually take and scan into the app tell you that these ingredients are actually what's on your skin, other products in that store or that area will actually be able to be identified and will give you an indication as what's better or worse to actually use. Sorry, I digress. Modern Water. 3,000 units have already been installed over the last 30 years in 60 countries. Clients include water utilities and normal, factories, wastewater treatment plants. We're already in these places. So it's not like we have to sell anybody anything. We're tapping into an existing, we are the incumbent in the market. We're not the largest, but we are now the one with AI in equipment that's already in place and we can retrofit. 700 scientific articles have been used with microtox. So this is a global gold standard, and allowing us to take our AI, which was the actual instant E. coli detection, and we were dropping it directly into Modern Water's microtox division before COVID. And we didn't even get involved in COVID until June of last year. So at that point in time, we decided, well, it's inevitable that if we can actually detect bacteria that small, we can detect COVID and other viruses. So we started off doing that. From a non-medical device, non-medical investor, it can be quite frustrating considering the regulatory requirements and the loopholes that you actually have to go through. And I'll touch on the actual the COVID testing and clinical trials that we've actually just gone through and explain a little bit more as to why the delays in getting a product out are important, but also necessary. So, as I said, we're in 60 countries, and it gives us a good footprint for a small company, but now being able to scale and the cooperation of a group of companies that are extremely large, which include Aptima Group, Avacta Group, Microsaic Systems are now involved in this, Tyndall, Dell Technologies, and other companies that I cannot name, but are extremely large, top 100 companies as part of this EcoWater OS. And again, further beyond this presentation, there will be further news. I'll actually bring those household names into your knowledge base. So what happened with Modern Water when we actually acquired it, or why we acquired that, and why we acquired it at such a state? Well, it had spent 30 million in cash, 42 million over a period of time that it actually had raised further money beyond that in secondary fundings, but 30 million upfront. And they spent that and they developed this technology. But back in 2011, they acquired a monitoring division. And this acquisition of this monitoring division was the footprint and is the footprint for which we're actually now taking and and expanding our advanced technology down through that channel. You don't get to take a view that you could just wait till it went bankrupt and then acquire the assets, because what happens is you end up taking away the mindset of the people involved. You end up taking away the value of the institutional accumulated knowledge and the distribution channels that are already there and the relationships that are already there. So it would be easy for us to say, oh, we could have waited down a couple of $100,000 and we could have bought it, but you'd have bought nothing but IP. And patents mean nothing. It's execution. It's only about execution. So back last year, they only turned over, it had gone pretty bad because, again, they let people down. And I'm not talking about the people who ran it. I'm just saying that the business itself, the business model, wasn't fulfilling sufficient cash flow to keep growing. And that was the problem. So they were actually tapping into the wrong revenue channel. And what we've done is we've actually turned it around very, very quickly. And it has allowed us, rather than have the order and then the deposit and then a letter of credit and then 16 weeks to deliver, we have orders up front. So when we got these orders of 3.6 million, they're now being produced. I mean, this is quarter one, 100 Microtox LX systems that are award-winning last in 2019 in China. The handheld devices, PD devices for immediate delivery. So consider what we actually acquired was a company that would take the order and then it would be weeks before they deliver. And we're an insatiable species. We want it now. And it's the same at corporate level. They want the equipment now. And if someone different, similar, better, worse, has something on the shelf, then that's what they actually took. We're now in a situation where we're able to actually get the product to them once they order it. We just ship it. The biggest thing for us, the biggest market for us, the biggest growth area, and it's not just for us, it's for the skincare. Estee Lauder, for instance, will have 25% of their entire global sales in China. Tesla has already said China will be their biggest market. Chinese market is phenomenal, and it's also extremely well financed for the demand of what the products are. COVID originated, from all intents and purposes, perception is that it actually originated from there. There is a substantial amount of people that have moved from the country to the cities. The water contamination situation is to be addressed. 540 billion is what the Chinese government are spending on development of the ecosystem over there. And the size of the market just in China is around about 4 to 5 billion. 4 to 5 billion. Because we're already there, the demand, they see what we've actually got, and they want more. So rather than actually them ordering and we wait, we're producing, we're shipping. And in the quarter two, we're going to be producing in China. We're going to be producing in EU, and we're going to be producing in the US. So there's no issue about cross tariffs or questions about delivery. I don't want to take this from the US. I don't want to buy China, stuff made in China. And again, we've resolved that situation completely. And the demand is going to have doubled by the end of the year. So we will have the capacity to produce twice what we're producing now at the end of this year because we're producing in these 3 states. The Microtox PD, wastewater, for anyone that actually doesn't hear me say wastewater, the pathogen detection system, we're producing these because we already have the demand for these to be put into specific places in the EU and in Europe, in European countries that are not in the EU. That's the best way I can actually say it at this point in time. And the idea here is that rather than jumping down manholes and detecting and bringing it back to the laboratory, the objective is to detect instantaneously that there is that there is SARS-CoV-2 virus or any pathogen that is decided upon for detection, and automatically take a sample from where the source is. So if you're taking a sample, if you're detecting a virus in the wastewater, it's from that point in time that you actually want to take the sample automatically. And you can only do that if you have real-time detection. Once you actually have that, you now have the captured target pathogen, which you can then collect and bring back to the laboratory and investigate the variants. So the only reason you would take it back to the laboratory is to inspect whether or not there are mutations, which is one of the biggest issues that we're actually going to be facing, and that is the evolution of the virus. We're not safe until everybody is safe. And therefore, there will always be some form of mutation. Every single vaccine that's been brought in, whether it was TB, whether it was smallpox, just because it's actually there does not mean that we're all covered. Some of these vaccines have taken 10, 15 years from origination to actually eliminate. And TB is not gone. So there's plenty of dangerous pathogens that are still out there. These also will be able to detect opioids, pharma products, Class A, Class B drugs, whatever it is that they're looking for in the area. Okay, so let me move on. The SARS-CoV-2 testing that we actually carried out in collaboration and cooperation with Public Health England. They provided us with the virus. At the Category 3 laboratories in the University of Aberdeen, the collaboration that we have with the Genoa University in Italy, and the Liverpool University collaboration that we have with the Tropical School of Medicine and Unilever. That is a longer project, testing a number of different types of product and ingredient for SARS-CoV-2. That takes time. Everything takes time when it comes to medicine because of the control element of this, the ethics committee, the approval level, the actual organization of getting access to the virus, maintaining it within the actual source, within the laboratories, having the people booked to actually carry out the testing and carrying out the testing. And then when it's done, tweak this, send it back to have a look under the electron microscope, and then tweaking it again and going back. And this has been a backwards and forward situation. And the third item on this slide shows that we actually can detect the spike protein of the virus at such a small level, that if it's there, we see it. If it's not there, we don't see it. Obviously, no false positives, because it will only detect the virus. And we use existing confirmed binding agents. So whether it's actually the aptamer from the aptamer group or whether it's the affamer from the avacta group, they capture the virus. Once it's actually captured on our nano microfluidic chip, our system, optofluidic detection system, identifies it using AI instantly. We've said in less than 60 seconds, but it's pretty instant. It just takes the time that the actual digital signal is transferred back to our server, compared to the existing data set of what we have there, and then sent back immediately. So it is seconds that we actually detect this. I've said close to 100% sensitivity, because scientists will never give us 100% definitive, subject to whatever could possibly be. You never know. It could well be that just because you've actually got a single virus particle bound onto these binding agents, how does that affect the surrounding area and stop the collection of other viral particles? So we had to build algorithms to calculate whether or not there was a charge differential between one particle and another to ensure that we were able to calculate the viral load. This gives us the opportunity, like no other opportunity, to be able to say whether there's a high viral load, whether there's an average spreader, or whether there's an asymptomatic person there. And that's the difference, you see, with a rapid test and what it is that we're doing, there's the ability to calculate within a very short period of time, seconds, whether or not you're dealing with a high viral load or an asymptomatic positive patient. And AI with Microtox BT is able to distinguish between this. And I must point out that the same, absolutely identical same technique is used to detect the virus on a microchip that detects the virus in wastewater as on the breath test, because the breath test is simply the condensate, that is the moisture from your breath. In cold winter's morning, you go out and that condensate that you actually see coming out, that is condensed onto a plate that is moist. Water from wastewater is filtered through a capillary element, which is just coating the actual surface of that plate. The detection system is identical, no difference whatsoever. The mechanism for actually taking the water or the moisture from your breath is different in and out, but the detection system is identical. So the clinical trial, there's a difference between clinical trial and observational. And we have seen observational, but it doesn't give us a control to test against. And under the UK Medical Health Regulatory Agency, MHRA, when they published earlier in the month, I think it was on the 3rd of March, they published the target product profile for rapid breath test. Now, there's an understanding that we have to go to a testing mechanism that is pretty close to instant, because nobody wants to stand around for 10 or 15 minutes in a queue, waiting to get into a stadium, waiting to get anywhere. So it has to be pretty instant. I'm not, for or against any rapid test. I just want something that is recyclable, sustainable, recoverable, and capable of being decontaminated at the same time. And that's basically the situation that we're actually dealing with. And that's from an engineering perspective. I was looking at that to ensure that we were going to be able to solve multiple problems, not just move one problem to another problem. So we're able to actually get 10% of the target. So there's 150 positive tests and 250 negative tests, negative detection in this target profile, product profile from the UK MHRA that required us to actually cover that amount. Now, going into a hospital and saying, please, sir, will you actually test your patients? It doesn't work like that. So there's ethics committee, there's doctors' cooperation, there's patient cooperation, there's nursing cooperation, and there's also the mayhem that goes on in a hospital. So you have to actually undertake a certain level of process. And it doesn't matter whether it's our company or any other test company. They've all had to go through the same processes, and rightly so, because what you don't want to do is well, it's near enough, can't, maybe, possible. Yeah, it has to be black and white. So you have to take positive and negative patients or subjects that have actually put on the actual appearance of them actually having COVID-19 and testing them and proving. So we've actually taken 40 subjects that we actually got in cooperation with the Royal College of Surgeons of Ireland. 16 had positive PCR tests, or PCR tests that were positive of SARS-CoV-2, and 24 of those had symptoms, or they felt were symptomatic of COVID, but had come out as having negative from a PCR test. And we had the breath test of those subjects as well, and used those subjects as control. Obviously, the 16 showed a 9-fold increase in the detection of SARS-CoV-2 against the control of subjects with no SARS-CoV-2. So that's pretty much, yes, you have it, no, you don't. Basically, you're talking about something that is 9 times the size. What? I refer to microsaic systems as the equivalent size of a hotel safe, and the standard mass spectrometer of being something the size of a good size home deep freezer. That's the difference. So you might trip over a hotel safe if it's on the floor, but you can't walk over or through a deep freezer. Again, simple imagery in my head. That's how I see the pictures. So anyway, the detection of the live virus was there in under 60 seconds. They require it to be under 90 seconds. We see it in seconds. But we're able to actually say that we meet the desire and the acceptance level of the vast majority of what's in the document to satisfy the UK Medical Health Regulatory Agency to allow the breath test to be rolled out later this year on completion of satisfactory additional clinical trials controlled from patients with and without positive PCR tests. And that suits everybody. You know that what you're going to be using works. That's the objective of a clinical trial, as opposed to observational. Yeah, I think he has it. I don't think he has it. If you don't have a control, it doesn't matter how many you have. We use them for data and the sourcing of data on test control subjects. But the control has to be done within an ethical clinical trial carried out under supervision, under the requirements to meet the UK MHRA minimum requirements. So, wastewater, as I said, identical to the breath test. The requirements from some of these European and EU countries that we currently are working with to have instant identification, detection and identification of the virus, to capture a sample exactly at the time that you detect it, so that they can then take it back and investigate the variants. There you've got instant alert of potential community spread, but also detection of where the origin of any variant and mutation may actually come from. That's what the Microtox PD is actually being built for and being installed for. There will be news on that, not today, but there will be news on that within a reasonably short period of time. And I can only just say if I said next week, it could be the week after that, it could be the week after, it could be a month or 2 months, but effectively by October the 1st, the EU has recommended that all countries across, all towns in excess of 150,000 people must have the means to detect in wastewater the SARS-CoV-2 virus and any mutation thereof. That will not mean thousands of people jumping down manholes and collecting samples. It has to be an automated system. It has to be an automated system that detects it as instant as possible and samples so that they can detect the source and origin of a mutant to actually detect patient 0 and keep it that way. The track and trace system must come from patient 0, and that's the objective of that. So this is the unit. We already have these units built. This on the left-hand side, this picture on the left-hand side is the units built, being installed. There will be large, medium, and portable, so that there will be the capability to actually go around and test instantly from a van. There will be a means to detect in laboratories samples as well. So there's a bench level. And then there's the installed base inline in situ detection system. And it's all from the data that's actually collected. This is the units. These are the microtrace units that are already installed. This small picture on the left-hand side is the filtration system. It just takes the sample through, it filters it, it cleans it, and any waste is actually sent back down. But as you can see, we already have the means for taking sample once it's instantly detected. So this is the system that is actually to be installed in the EU and non-EU countries. Can't say any more than that. As far as the numbers are concerned, I've covered it on the front of this presentation. These are just the numbers that actually in June, when we acquired a mid-year consolidated balance sheet, etc. It showed that we had cash and equivalents in June of 2 million between the two. At the end of the year, we had cash and equivalent of about 3 million with some of the debt drawn down, and further we had taken in 650,000. Now, our growth is such that it is generating revenue, and it just basically depends on how well we manage our growth. But I'm certainly looking forward to actually a phenomenal 2021. The investment case, I've said this in the last presentation that I gave earlier in the year. I've revised down the actual cruise industry size to 2 billion from 2.6 billion. Sorry, there's justificational reasons for that, but I certainly have actually dropped it down. And we are working with parties within this industry to ensure that the potential for this can be realized once we have multiple countries within the EU and non-EU at port to accept both the breath test and the wastewater detection from cruise industry to get them back up and running. As I said, this is not going away. It's not going away this year. It's not going away next year. It'll be years that we'll be dealing with this and still needing to actually address norovirus and other viruses and the next pathogen. And it's going to be about prevention, because I don't think there's a country in the world, developed or otherwise, who wants to actually have to address another 2 years of this crap and having to deal with the anxiety level, the mental health level, and also the actual, unfortunate element of the people who passed because of COVID-19. Our support structure and the most that's around our technology is the 14 years in Labskin that we've actually grown. The actual clients of ours who respect and use this on a regular basis. We are the industry thought leader in skin microbiome. We are the only ones who could possibly let your skin explain to you what it needs from our own democratization of clinical trial for individuals' skin. The 5 years development of our AI in RhinoCloud that we've dropped into modern water is enhancing the revenue stream, because it's not just taking consumables from the reagent bacteria that we actually have for detecting toxins and bacteria, but it's also monitoring, so to give 24/7 detection information to the client. And that is also added to the predictive element of the weather. So if there's storms projected, whether or not the rise in will cause overflow from the from wastewater into rivers and lakes. So there's much more to it than just simply detecting COVID in a sewer, in a wastewater treatment plant or in a hospital, etc. And then 40 years is how long the company has been involved in toxicity testing. 30 years, Microtox has been a trusted brand in over 3,000 units installed in 60 plus countries. So if you're asking whether or not it's a safe investment, it's an awful lot safer now than it ever was, simply because we're now just managing rapid growth, not survival, paying off massive debts that we didn't even have revenue to actually cover. Now we have debt offers on a regular basis for us to actually grow this company. Thank you very much, everybody. I'm sure there's a few questions that Paul would like to actually read through. I'll just take them if he doesn't mind.
That's absolutely great, Jerry. Thank you very much indeed for the comprehensive presentation. And ladies and gentlemen, do please continue to submit your questions using the Q&A tab situated on the bottom right-hand corner of your screen. Just before jumping into the questions, we would like to remind you that recording the presentation, along with a copy of the slides and the published Q&A, can be accessed via your investor dashboard on the Investor Meet Company platform, and also that your feedback is important to the company, and immediately after the presentation has ended, you'll be redirected for the opportunity to provide that feedback. Jerry, just to touch on for investors, we had a number of pre-submitted questions, and you were very kind in answering all of these, and these will be published later on along with the Q&A from today. But as you say, we've had a number of questions that have come in, so perhaps I can start with this one. Does the Microsoft's PD nanochip need to be replaced every time COVID is detected?
Okay, so it depends on whether it's a breath test or whether it's actually in the pathogen detection in the PD wastewater. So what we're looking for in the wastewater is the detection of the virus at a specific point in time. So they are replaceable and automatically with robotic arms in those units, replaceable after a certain period of time. Now that can be whether it's actually 4 hours, 10 hours, or on detection of a specific number of viral load. Because again, you're not giving an instant detection, you're actually just detecting that this virus is actually in the target itself and capturing the water at that point in time. Don't forget, at that point in time, when there is virus already on the water, if there's no further virus for a period of time, the image, the digital image remains the same. It will change if further detection of virus comes in, and then you take another sample. When it comes to the breath test, they are individual testing plates. So you have your own individual personal breath test, breathalyzer test, and the chip associated with that is not touched by anybody. It is actually fed directly into the Microsoft's BT unit. It is scanned, and once it's scanned, UV, ultraviolet light, is actually used to kill the virus, and it is dropped into the unit itself. So it's never touched and recoverable once the actual thing has been decontaminated.
That's fantastic. Thank you very much indeed. Another one we've got here about Skin Club and around, referencing and recommending products. Will you look to take a revenue stream from this, or how would that work? Is there a sort of a revenue angle for you guys there?
We want to remain agnostic, which basically means we don't want to be associated with any particular brand. And for that purpose, we would not be taking fees for the sale of product at this point in time. There's no reason for us to do that, because why are you actually selling this product? You then just become a product sales organization. Our objective here is to have the ability to provide the consumer with the data they need to make an informed choice of the products that they would like to use based on the recommendation that we make. We get our revenue from the test, but also that helps us improve the efficiency, the data of that anonymized data that we collect, improves the efficiency and the size of our skin microbiome database. We're already the largest skin microbiome database in the world, and it then becomes a virtual volume of data that we can test, for instance, for what specific species of bacteria or microbe is on the skin that would indicate that you have this type of atopic dermatitis or that variation of psoriasis or whatever. So our objective is actually to make this, being from the pharma side of the business, we will generate revenue from using major corporations' ingredient testing on the anonymized data that we actually have, which is far more valuable than what we will be generating in revenue from the individuals using the Skin Trust Club.
That's great. Thank you very much indeed. Next one we've got here, just really sort of touching on that, you said about the fact you've got 14 years of skin data. What's the angle there to monetize that data? How can you monetize it? And what are the opportunities around that?
We already monetize it. We already have a virtual skin clinical trial for clients. So right now, a company would spend perhaps 5 million, about 500,000 per ingredient or product that they want to test. And it's mostly ingredients that I give this example. And of those ingredients, they want 2 of the 10 which are better than any, so that they could move forward and actually put them into an ingredient, and here's a new launch of a new product, etc., in 12 to 18 months. So normally it would take 6 months and a full report and diagnostic and testing on this and in vitro that and you know, all of that stuff. Virtually, we can take those ingredients and with the database that we have, match them to the effects that it has on all of the species of the bacteria on your skin, and give you back almost within a matter of an hour or two which of those 10 are better. So now you're moving forward with 2 of the 10, having saved 4 million from detecting which of those 10 2 are the better. So now we've saved 4 million, which is why we can charge between 150 and 200,000 for that test. And that's margin is extremely high because it's data. And nobody else in the world has that data.
That's great. Thanks, Jerry. We've got a couple of questions here just around competition, be that, you know, water monitoring, be that Labskin. Could you just give us a little flavour on that competitive environment you operate in?
The water industry, the water monitoring industry currently is just under $5 billion per year. Sorry, it's 6.7 billion, and it's growing at about 7% a year. For us and the amount of revenue that we're getting currently, we're not even tipping a tiny piece of 1%. When you think the revenue generated from Modern Water last year was just a little over 2 million, and we've orders this year of a little over 3.7 million or whatever it is, it just doesn't even register yet. We haven't tapped into anything. And it's just because we have the capability of being an incumbent, recognized gold standard in toxicity testing for 30 years, we have the ability to tap into that and accelerate our revenue stream and recurrent revenues from the existing system that's already there. You still have ThyssenKrupp, you still have China Resources, you have large water monitoring corporations out there. The difference between them and ourselves is that we're nimble enough with AI, and having designed this come in from a different angle, we're offering something that is not offered yet. So most large corporations rarely internally evolve and innovate. They generally acquire. So if we continue on the route that we are continuing on, there's no doubt in my mind that we will be approached for the benefit of everybody to participate on a bigger scale with other parties. And I couldn't go any further than that.
That's fantastic. And perhaps 2 more questions as we're coming up to the hour. And we've had a few questions, Jerry, which you have touched on, just, you know, how long will the COVID breath test clinical trials take? You know, what are the timelines around that? I know you have alluded to that, but just to confirm to the attendees, that'd be fantastic.
Okay, so I can't put a definitive date because there are multiple third parties involved in actually doing this in collaboration with hospitals and doctors and authorities and ethics committees and stuff like that. In order for us to get up to that specific number, I would estimate it's certainly going to be closer to the end of the second quarter, the beginning of the third quarter, before we're in a position to have further reporting to meet some of the actual minimum requirement. We already meet most of the requirements of the actual target product profile. This is just the actual remaining number of patients that we actually have. So it's this year. It more likely is going to be available in the third quarter. But bear this in mind, by changing the binders on the breath test, we detect for other stuff. So there's no reason why this cannot be used by a GP, for instance, to detect different types of diseases, throat cancers, respiratory diseases, tuberculosis, pneumonia, bacterial infection rather than viral infection, throat infection, as opposed to sending everybody up to get a test. The test is capable of being done in a GP's office. So those are the longer term for what we're looking at. You know, from a COVID perspective, this isn't going away for years, as I said, and we will be rolling it out this year. It's just that COVID is one of about 40 identified pathogens that we're capable of detecting with the right binders from the Avacta group or from the Aptamer group, which we're currently working on.
That's great. And just perhaps the last one we can squeeze in, Jerry, if I may. A couple of questions around, could you expand on your partnership with Microsaic Systems and just give a little bit more flavour there? So
back in September, when we showed the prototype of our Microtox BT unit, it was about the size of a hotel safe. That's a reasonable. I think everyone actually understands about the size of that of a hotel safe. But when you start to add in the necessary additional elements to that unit from off-the-shelf components, it becomes a bigger and bigger unit, and it gets to the size of a decent-sized printer. So it's no longer something that is easily maneuverable around. And with Microsaic, they've spent 19 years miniaturizing microengineering, and mass spectrometer is basically another extreme digital data collecting mechanism. So we understood from the investigation before we got involved in actually helping to fund them, what they could actually do for us, and I was about to say the failure of, I would say that the alternative business model that they had of selling pieces of equipment, we knew that if we added artificial intelligence into Microsaic, we could actually lift their business model and help them to generate recurring revenue through solving problems. And in that case, both our Microtox engineering team and the Microsaic systems team are currently collaborating with Aptamer Group to identify the capability of bringing the breath test to a much smaller piece of kit. Something that size, it's my heartburn, instead of something that size. So it's basically miniaturization. And we're taking their equipment and selling it through our own distribution channel that we have built in the countries where we are currently, in China, in the US, and giving them office facilities through our our commercial and technology agreements that we actually put in place earlier this month. And for us, we would be we as in chairman of Microsaic Systems will be in licensing from RhinoCloud, artificial intelligence, and the use of the actual data that we have to allow them to detect instantly inline processing in production or in production processing of pharmaceutical ingredients, bioprocessing units, biofuel, bioethanol, lots of things that you would normally take samples from to a laboratory can now be done inline, and with AI instantly tell you that this batch is actually having a problem, therefore stop and don't waste another £500,000 for a batch or whatever it is. So there's benefits for both of the companies, and we've also introduced them to all of the partners in the EcoWater OS, including Dell Corporation, etc. So there is this wonderful group of corporations cooperatively, collaboration together to solve some big problems, some big societal problems. And I think COVID has actually done that to a lot of organizations, certainly within the diagnostic industry. I've seen so much more collaboration and cooperation than I've ever seen before working in this industry.
Thanks, Jerry. I think on that note, we'll look to wrap up, and thank you for addressing questions from investors today. And of course, if your question wasn't picked up, Jerry will have the opportunity to review all the questions submitted today, and we'll publish responses where it's appropriate to do so. Jerry, just perhaps a final couple of words just to wrap up before we give investors the opportunity to give you some feedback, please.
Okay. I just want to actually, I'm deeply grateful for the support that we've actually had. And, the first 2 years of turning this company around was very tough. It was very tough on employees. It was very tough on the people at management. It was very tough on the actual support from advisors. It was very tough even on the lawyers and on the actual brokers, etc. So I'm deeply grateful to everyone who has actually helped support us throughout the last 2 years. And I am very happy that we are able to actually increase the revenue of the company to the way that we've actually increased it, to generate the increase in the value of the company, to let people see the potential of this. But as I said, most importantly, I'm grateful for the support that I've actually had from the shareholders, and look forward to actually working with them and continuing to communicate, possibly annoy them all on Twitter. Thank you very much.
On that note, Jerry, thank you very much indeed for updating investors today. Please could I ask investors not to close the session, as you will be automatically redirected for the opportunity to provide your feedback. If you've accessed the meeting from the website, the page will be in front of you. If you've accessed via the link in the email, you'll be asked just to log in. It takes just a few seconds, and it will be greatly appreciated by Jerry and the team. On behalf of Jerry and DEEPVERGE PLC, thank you very much for attending today's presentation. That concludes today's session. Thank you. Good afternoon.